I am Dr. Pradeep Kumar Reddy. I am a consultant radiation oncologist at Sri Shankara Cancer Hospital, Department of Radiotherapy. Today we will be talking about brachytherapy. So in general, there are different types the way radiation can be delivered. So there are something called as external beam radiotherapy or teletherapy. So teletherapy is where the radiation is being delivered from a distance. And the other form of delivering radiotherapy is called as internal treatment or brachytherapy. So in internal radiation or brachytherapy, so the radioactive substances are placed in close vicinity of the tumor, and the radiation can be delivered very precisely to the tumor area that we want to deliver. So brachytherapy means in close relation to the tumor. So again, in brachytherapy, so there are different types of brachytherapy depending upon the dose rate or depending upon the radioactive substance that is being used. So based on the dose rate of the radioactive substance, the brachytherapy can be divided into low dose rate brachytherapy, high dose rate brachytherapy. So it all depends on the source that is being used for delivering the radiation. And most commonly, the current radiotherapy departments, they use the HDR brachytherapy. And it could be, there are two different sources that are commonly available. So one is the iridium-192 and the other one is cobalt-60. So there are some slight differences between the physical properties of each radioactive substance. But most commonly, the iridium is the one that is being used for delivering the high dose rate brachytherapy. And again, brachytherapy can be divided into different types based on the locations or the type of the organ that is where we are using the radiotherapy. So for example, there is something called as intracavitary brachytherapy. So commonly it is called as ICBT. So in this, there will be applicators which will be used or which will be kept in the cavity of the organs. So the most common area where intracavitary brachytherapy will be done is for the carcinoma cervix. The other type is called as interstitial brachytherapy or ISBT. So in this ISBT, there are needles which are hollow, which will be closed into the or closed or put into the area where we wanted to deliver the radiation. And once the needles are put into the tumor, so these tubes will be hollow. The radioactive substance will be passed through these channels and the radiation will be delivered wherever the needles have been put. The other type of radiotherapy is intraluminal brachytherapy. So there are some organs which will have a lumen in them or consider them as a hollow structures or cylindrical structures where an applicator can be passed through the organ and the radiation delivering source can be passed through the applicator and radiation can be delivered. So the most common area where intraluminal brachytherapy is done is carcinoma esophagus. And the other areas could be biliary tract malignancies where a percutaneous drainage tube would have been kept and through which the radiation sources will be passed to deliver the radiation. And the other type of radiation is called as surface mold. This is generally kept on tumors where they are on the surface. So assuming there is some skin cancer which is on the surface of the skin, so the radiation sources can be directly kept in the vicinity of the tumor and the radiation can be delivered to that. So there are various sites where brachytherapy can be done. There are some situations where brachytherapy can be done alone, or most of the times there will be a combination of external radiotherapy and brachytherapy. So for example, the most common areas where brachytherapy is done is the gynecological malignancies. So in that, carcinoma cervix is the one where there is always a combination of external radiotherapy and the internal radiotherapy. So cervical cancer patients, so once they have decided to treat with radiotherapy, so there will be initial 5 to 6 weeks of external radiation, following which there will be a gap of 2 weeks and the patient will be then taken up for the brachytherapy procedure. So most of the times the brachytherapy procedure is done under anesthesia so that patient does not have a discomfort or pain of the procedure, and examination or anesthesia will be done, and based on the anatomy patient will be assessed and adequate applicate sized applicators will be placed inside the cervix as well as the uterus, and then the radiation treatment planning will be done. So that's the classical example of combination of external radiotherapy and intracavitary brachytherapy. So similarly, for some reason, if some patient of cervix who has undergone surgery or hysterectomy earlier, and if they develop cancer in the vault or the area where that uterus has been there, so they will be generally considered for interstitial brachytherapy. So interstitial brachytherapy also, it will be always same thing. It's a combination of external radiation and interstitial brachytherapy. So the difference between intracavitary and the interstitial is, so intracavitary there will be an intact uterus, and generally for the interstitial the uterus would have been already been removed and there will be only a vault. So for interstitial brachytherapy, again procedure will be done under anesthesia, and depending upon the requirement, so generally around 12 to 16 needles will be placed using an special applicators or templates. And once the applicator or needles have been placed, so there will be subsequently, there will be a CT scan that will be done, and we will identify the area for which the radiation has to be planned. So similarly, so combination of external radiotherapy and brachytherapy will be done in case of carcinoma esophagus also. But the type of brachytherapy that will be used for esophagus is called as intraluminal brachytherapy. So similar to the earlier settings, so there will be 5 weeks of external radiation, following which there will be a gap of 2 to 3 weeks so that the patients can recover from the side effects of radiotherapy, external radiotherapy. And once the patient has been decided to do for intraluminal brachytherapy, so there will be an applicator which will be passed through the esophagus, and the radiation source will be passed through the same applicator, and the radiation will be delivered precisely to the area where we want. The other common areas where brachytherapy can be done is called as, again, interstitial brachytherapy. So that can be done for carcinoma tongue. So generally tongue is an organ which is located in the head and neck region. So once the surgery has been done in the adjuvant setting, in addition to external radiation or brachytherapy alone, interstitial brachytherapy alone can be done for the tumor bed. So the process is same. So again, patient will be examined, procedure will be done under anesthesia, examination and anesthesia will be done, and the area where the needles has to be put will be identified, and the procedure will be done under anesthesia in the operation theater. Once the procedure has been done, patient will be shifted for a CT simulation where we will do a CT scan and identify an area where we wanted to treat. So once the planning has been done, so patient will be again shifted to a dedicated room where the radioactive substance will be present. So that tubes are connected with the transfer tubes, and the radiation from the radiation source can go into the tumor area or through the needles through which that have been put, and the radiation will be delivered very precisely to the area where we wanted to deliver. So the other area where interstitial brachytherapy can be very effective is soft tissue sarcomas. So soft tissue sarcomas are the tumors that generally arise in the muscles and the connective tissues. The mainstay of the treatment will be the surgery. So once the surgery has been done, so surgeons will involve the radiation oncologist to put the needles into the tumor bed, what we call. Surgeon would have removed that entire tumor. So the area that has been removed by the surgeon, we will place the needles in such a way they are equidistant, and the entire procedure will be done under the anesthesia. So once we put the needles in the area where we wanted to put, so the wound will be closed as per the surgeon. And once the application has been done, so 5 days or 6 days later, we will identify again an area where we wanted to give radiation with the help of a CT scan. And once the CT scan is done, we will plan the treatment, and the radiation will be delivered through the tubes that has been put at the time of the surgery. So the other areas where interstitial brachytherapy can be of great use is in case of carcinomas of prostate. So again, prostate radiotherapy plays a very important role. So radiotherapy can always be a combination of external radiotherapy and brachytherapy. So similar to other situations, so most of the times it is the combination of the external beam radiotherapy as well as the interstitial radiotherapy. 5 to 6 weeks of radiation will be delivered first, and there will be a gap of 2 to 3 weeks, and then patient will be taken up for the brachytherapy procedure. So the needles will be put under ultrasound guidance. So there is a special dedicated equipment for doing the prostate brachytherapy, so which will actually give us a real-time information of the location of the prostate, and simultaneously we can actually look at the position of the needles, whether the needles have gone exactly into the prostate or not, and that will help us to identify the exact location where we want to put the needles. And once the procedure is done, we will do a CT scan again, and the radiotherapy will be planned in such a way that the radiation is delivered only to the areas where we want it to deliver. And there are some critical structures in prostate like the urethra where the radiation should not go. So that could be precisely be identified on a CT scan, and the radiotherapy treatment can be planned precisely so that the radiotherapy will not be delivered or there will be no side effects with respect to the urethra. So advantages of brachytherapy. So brachytherapy could be of any form. It could be an intracavitary, or it could be an interstitial brachytherapy, or it could be an intraluminal brachytherapy. So the biggest advantage of brachytherapy is the rapid dose follow-up. So what does it mean? So the dose is actually precisely delivered in a very high doses to the tumor per se, and the adjacent normal structures will actually get very minimum radiation from the brachytherapy. When compared to external, when radiation is being delivered through teletherapy, there is a good amount of radiation that can go to the adjacent organs. But with brachytherapy, because of the physical properties of the radioactive substances, so the dose delivered to the adjacent normal structures will be very less. So that way, you can say that brachytherapy is a very conformal type of radiotherapy. Any queries or any other doubts you have, you can always contact our department for clarification. So we are always available at the Department of Radiotherapy, Sri Shankara Cancer Hospital and Research Center.